I am delighted to be joined this evening by Dr. Ruhy Parris, who is a longtime member of the Board of Trustees of the Edinburgh Interfaith Association and now a retired anesthetist here in the city of Edinburgh. I wonder, since we're talking this week about healing and faith and spirituality, could you provide one or two examples from your own life, Ruhy, of how faith or spirituality or just belief has helped you through a difficult time?
Absolutely. Obviously, throughout my long career of around 40 years in the NHS, I dealt with other people's problems on a daily basis. And, I was always struck by people of various faiths, or maybe no faith, but deeply spiritual. And it wasn't until something so deep affected me and my family that I really began to feel that I truly understand what my patients went through. 5 years ago, my husband, who was a long-time supporter of the Edinburgh Interfaith Association, and he was a doctor himself, he was diagnosed literally overnight with terminal cancer. And obviously, both of us knew exactly what was going on with the pathophysiology of his disease, the different treatment options open, and we went into our medical mode looking at it. But also as people of faith, we very much as a couple and as a family started to pray even more so than ever together as a family. And obviously I had to drop all my commitments with everything I did to look after him and care for him in his final months. But through my own Baha'i connections, through my connections with the Interfaith Association, the messages started coming to us both, that people, not only in our family circle, our immediate circle, were praying for us. And it wasn't necessarily people that knew us personally, but people were going back to their places of worship, going back to their communities and saying, we know these people, they have been working with us in Interfaith, they are facing a personal challenge and difficulty. Please remember them in your prayers. So from across the world, different faith communities were praying for John and our family. And believe me, that sustained us through that 6 very difficult months from his diagnosis to his passing. And I don't know how we could have got through this as a family without that knowledge that there were so many friends out there that maybe didn't know us that well, but they were actually looking out for us.
That is so powerful. Does the Baha'i faith have a particular prayer for healing?
There are many, many beautiful prayers in the writings of Baha'u'llah and also his son Abdul Baha, who was his successor. And Abdul Baha visited Edinburgh in 1913. So we have that close connection as a city with Abdul Baha, the son of Baha'u'llah. And we have many, many beautiful, beautiful prayers. Some are short, some are very long. And the long healing prayer takes quite some time to read, but it's a beautiful, beautiful prayer. And if I could share with you a couple of its verses.
Please.
A very short healing prayer. So this is a few words of Baha'u'llah. Thy name is my healing, O my God, and remembrance of thee is my remedy. Nearness to thee is my hope, and love for thee is my companion. Thy mercy to me is my healing and my succor in both this world and the world to come. Thou verily art the all-bountiful, the all-knowing, the all-wise. So it all comes that thy name is my healing, O my God, and remembrance of thee is my remedy. So healing is not just a physical healing with, let's cut out that thing that is causing your cancer, let's kill all the cells around it. But mentioning the name of God and remembering the name of God is part of this healing process.
And it's
And
also a prayer of praise. It's not a lament. It's a prayer of praise. I think that's wonderful. We have something similar in Judaism. It's called the Mishabera prayer, where we praise God and then we ask for relief from pain and a complete healing, a refuah shlama. So it's similar how the two faiths have this similar approach to
there
healing
is
through
so much
prayer.
similarity between all the different uh, faiths. And as we all know, just praying for healing and asking God does not mean that it will automatically be granted. And this is where we have to submit ourselves to the will of God and that divine wisdom that maybe for some in their spiritual journey, because remember, we're all spiritual beings having a physical journey whilst we're on this plane, and not the other way around. We're not physical beings having a spiritual journey, but we're spiritual beings having this physical journey. That for some, our time on this physical plane is limited, and there is some wider purpose and wisdom behind this. So,
And
it may
sometimes it
be
takes
that
an
the
illness,
healing
sadly,
that we
for
are
you
hoping
to,
for is not in our interest, though we may not be aware of it on this plane.
and sometimes it takes an illness to actually elevate it to that higher purpose. I
Yeah.
was wondering, you mentioned how the Edinburgh Interfaith Association had been supportive of you with all the faiths praying for John during his illness. How have you seen the organization grow over the last 3 decades, change and develop? Give me your perception of Edinburgh Interfaith at the beginning and through the journey today.
Yeah. Well, I'll have to rewind longer than 30 years ago because last year we celebrated our 30th anniversary as an organization. So in 1989, we formally started as the Edinburgh Interfaith Association. If we go back a little bit further to the early 80s, it was Professor Frank Whaling, emeritus professor at New College and himself a Methodist minister. He actually went round to every single faith community in Edinburgh and sat in with each faith community as a fly on the wall at the various meetings, got to know people, gained the trust of the different faith communities and wanted to understand more about all the different communities. And it was his driving force and motivation that got people together in the first place. And in 1989, we formally started the Edinburgh Interfaith Association. So from those tentative beginnings, and remember 1989 is a long, long time ago, beginning of 1989, we still had the Berlin Wall. 1989, November 89, the Berlin Wall was coming down and none of us knew how much social change there was going to be in that year. So there's a lot has happened, and Edinburgh has become far more diverse, much more cosmopolitan. It has become very rich, and we are now celebrating all our different faith communities, all the wonderful ethnicities. Our universities, our neighborhoods are full of different languages being spoken, and our community as Edinburgh has been enriched by all this diversity. And hand in hand with that, I've seen how the contribution of the Edinburgh Interfaith Association has added to all those discourses that the diversity has brought. We have worked with schools, offering panel members. And believe me, no forum on this earth is as more probing as a bunch of school children asking you very awkward questions on the spot. They will just get to the core of you. So working with school children and schools, working with the police and social services so that they have an understanding of the different faiths, working with the wider community, civic community, with the city council, with the NHS, making sure that the different nuances of the different faiths and the different needs are understood. With so many people of different faiths going into hospitals and care homes with different beliefs around you know, life and death, all those difficult times. It was important that we worked and made sure that there was knowledge out there for how to treat births and deaths in a hospital setting. And so much good work has been done. And I've seen it grow from a tiny organization to one that is part of the fabric of Edinburgh city community life.
Yes, it's interesting to me that recently the city, due to the pandemic, has been having these resilience meetings, which you've been participating in. And
Yeah.
at the table, you have the fire service, the police service, the NHS, and the Edinburgh Interfaith Association. That shows you how integral this association has become to this great city. So how do you see, Ruhy, faith, spirituality, health, and well-being developing now in the future? We've talked about the history of the association. So for example, is faith an alternative or a complementary form of healthcare for some folks? What are your thoughts on that?
Well, as a Baha'i, my faith tells me that faith goes hand in hand with the physical means to deal with illnesses. So, you know, it's not that they are completely separate systems. They're very, very interlinked. They are coordinated. And certainly, as we've heard from our previous guests in the program, you know, what happens to us in our early life, traumatic events, can have lasting impact on our lives, not just emotional well-being and mental well-being, but also on physical well-being. Now, for many, many years, I was a consultant in anesthesia, and also my special subspecialty interest in that field was in pain medicine.
Mm-hmm.
So I dealt primarily with people with chronic, non-malignant pain, people with long-standing conditions of which pain was a big feature. And this covered a huge variety of conditions, some of which were better understood than others. And the reason that anaesthetists were involved with pain in the first place was all those years ago when we were brandishing our big needles and palliative care wasn't established, our colleagues would ask us, you know, can you do something for this patient's pain? So you'd go along with big needles and very, you know, powerful injections to try and relieve their pain. And, you know, this method continued, and gradually anaesthetists began to be asked to deal with people that had long-standing pain conditions that weren't necessarily associated with malignancy. And it soon became very apparent that those techniques of injections, of putting something in and making it better and relieve that suffering, wasn't necessarily the case. Now, that's not to say that there isn't room for certain types of injection therapy in certain types of circumscribed pain conditions.
Mm-hmm.
However, what did become apparent was that pain was not just physical suffering. There was a huge element of emotional suffering.
Mm-hmm.
And many aspects of that suffering went way back to childhood and was involved with abuse, physical abuse, how people developed, you know, sexual violence, domestic violence. All these things would affect how people's perceptions of pain, their heightened sense of fight or flight would be there. And this is how we became, as a specialty, aware that physical rehabilitation with specialist physiotherapists, clinical psychologists, psychotherapists, all these people were essential to be part of that team to deal with the emotional and physical suffering. And this is why that pain is so dependent on our experiences in life. And certainly, you know, I wouldn't advocate that just purely on faith grounds alone, that the power of prayer will cure absolutely every ailment. However, it can help. That is only if somebody is prepared to want to let it help as well. So it's very much a state of being that you've got to be ready to accept that, you leave your anger and your past behind and you want to try and heal.
It's so complex and yet so interesting because it shows that as human beings, we are complex and you must treat pain and trauma not just with medicine, but with other complementary forms such as faith. So, what do you believe, Ruhy, are the most important tasks for interfaith organizations such as EIFA in the 21st century? I ask that because in Judaism, we practice something called tikkun olam, which means to heal the world. We assume every morning the world is broken, and it is our responsibility to go out and in some way, through a commandment, something, a good deed, to heal the world. What do you think the Edinburgh Interfaith Association can do to further heal the world?
Yeah. Just a small question then. Yeah. Well,
Yeah.
as a Baha'i, one of the injunctions that is on me is to go and consort with the peoples of all faiths in a spirit of friendliness and fellowship. And this is a principle that not just me, but all my friends and colleagues at the Edinburgh Interfaith Association have been advocating, that we go and we meet with people in a spirit of friendliness and fellowship, and we learn from each other, we listen, we show understanding, we show compassion. In the days when interfaiths originally started, many, many decades ago, the tone of the discussion, the discourse was all about religious tolerance. And I never liked that word, not even then. Tolerance implies, well, we don't really like you, but we won't kill you. You can live there, it's okay, but we don't really like you. Whereas now the discourse is much more elevated. It's about understanding, it's about compassion, it's about kindness, about supporting each other. Now, the pandemic has allowed all of us in the world, not just the Interfaith Association, absolutely every single person, to have a pause to reflect, a pause to actually contemplate what sort of world do we want to see when we emerge from this. And we're in a position that we're on a cusp of something bigger, that, maybe that we're going to get greater insights. Maybe we, are going to have an early glimmering of the possibility of a moment of collective consciousness, that, we're all in this together, though the impact of the pandemic may be different on different societies, and it has magnified the inequalities in our societies, that maybe we will have this understanding that we are one human family, that we are all interconnected and we are all interdependent. And I would hope that in Edinburgh, here in our community of this wonderful city and environs, we can help elevate these discourses to say, yeah, we are essentially the one family. We've got to look at different ways of dealing with the health fallout, the mental health fallout, the educational fallout, the suffering that our children are going through by being deprived of 6 months plus of education, the poverty, the economic impact. These are all things that we can work together and work out solutions. It doesn't come down to the simplicity of GDP, not at all. We have to have these elevated discussions, and we're seeing increasingly that in communities where health is put ahead of wealth,
Yes.
They are working better together and
Yes.
have a more united vision of where they want to go. Whereas communities where, everything is not really shut down and they want to get the economy going again on a certain model, then, that affects the health of the workers, and we may not have a community to generate that wealth in the first place. So let's, as faith communities here in Edinburgh, look at how we want to see our city developing.
Well, you've helped me see a new way of looking at health and looking at faith by combining the two and creating a community of healers where all of us are actively engaged in terms of healing one another, healing ourselves, and healing the greater society. If you're interested in learning more about the Baha'i faith, I invite you to visit the website. And on behalf of the Edinburgh Interfaith Association, may I thank you, Dr. Parris, for 3 decades of leadership in our association, for 4 decades of leadership in the NHS, and for today, leading us further on this journey of better understanding of how we can all become healers of society through combining medicine, spirituality, and faith. Thank you, Ruhy.
Thank you.
Cheers.
Bye.